Good afternoon. Thank you for joining us. I'm trusting that you all had a good, safe holiday weekend. We've got a lot to go over. Dr. Box, you've got a fairly comprehensive report here. You'll be talking about updates and progress in long-term care testing. You'll be talking about the updates and how the school dashboard has rolled out. And then we're adding additional testing sites that are going to be able to supplement or complement the Optum sites all over the state of Indiana, about 95 up to $30 million investment. So that in and of itself is another step in the right direction. And I'm never ceased to be amazed by what you share with me, but proving just how Hoosier you are. Right before we went on live, you shared that you said, Governor, do you know that Jimmy Johnson is now moving over to IndyCar and he's going to be driving for Chip Ganassi? So with that, I don't know what else you had to share, but there's 4 updates that are pretty thorough for Indiana. So exactly. I'll turn it over to you now.
Thanks, Governor. Good afternoon, Hoosiers. Today we reported 720 additional cases of COVID-19 in Indiana, which brings our total to 101,485, the total number of Hoosiers known to have COVID. We also saw 17 additional confirmed deaths. To date, 3,173 Hoosiers have died of COVID-19, and another 224 are believed to have died from this disease based on their clinical diagnosis. Currently, more than 43% of ICU beds and nearly 82% of ventilators are still available. Less than 10% of occupied ICU beds and nearly ICU beds are housing patients who have either been diagnosed with COVID or have symptoms of COVID. Less than 3% of ventilators are being used by someone who has COVID or is suspected of having it. As of September 7th, 839 Hoosiers were hospitalized with COVID or COVID-related symptoms. Our 7-day positivity rate for all tests was 5.1% as of September 2nd, while our cumulative rate was 6.6%. I also want to share our latest data on hospitalizations and recovery from our partners at Regenstrief. To date, they have looked at 95,654 cases. Of those, 21% visited the emergency department, which is down slightly from last week. A total of 11,467 were hospitalized, which represents a 12% of all the positive cases. Of those who were hospitalized, 20% were admitted to the ICU, which is down slightly from last week. That represents 2% of all positive patients. 76% of hospitalized patients have been discharged, which is a slight decrease. Of the remaining 24%, 6% are believed to still be hospitalized, and 18% are known to have died while hospitalized. Regenstrief also estimates that 82% of patients have recovered, which is an increase from 79% last week. We continue to make progress on gathering the information we need for a school dashboard. This week we're testing an electronic portal that is designed to streamline the reporting needs for our schools. We originally planned to have a separate reporting system and heard loud and clear from our schools that that was a burden when they were already stressed. So we took another look at our existing system and found a way to combine the two and get the information needed to build the dashboard without requiring duplicate reporting. Once we're sure that we have all the kinks worked out, we will alert schools so that they can start gathering the data to assemble the dashboard. Our goal is to be able to report cases by school, not just by school district. But I want to make some important clarifications here. No individual will be identified by name. Schools that have fewer than 5 cases will have their numbers suppressed to protect the privacy of the individuals who tested positive. We do this with any disease outbreak, so it is consistent with our approach. We will not list the age of individuals who test positive in the school list, but we will provide aggregate age ranges and other demographic information on a statewide basis. I've been asked why we're creating this dashboard when we haven't done the same for businesses or for churches. Quite simply, we've been asked to provide this information. We've heard it from parents, we've heard it from schools, and we've heard it from other stakeholders, all asking for the information to be public. The purpose is not to stigmatize a school or to penalize them. The purpose is not to mandate whether schools are hosting in-person classes or going virtual, because those decisions are made locally. Rather, the purpose is to help all of us make the best decisions possible as we navigate this pandemic. None of this information will lead to a solution that pleases everyone. That's something that simply isn't possible while we're dealing with this pandemic. But I firmly believe that this knowledge will be powerful, and knowing that what's happening in our schools helps us to make the best decisions we can in real time. I also want to update you on university testing. We've been posting all results that have been submitted to us on our dashboard. We are also in the process of onboarding Vault Labs, which has been testing the saliva samples from Indiana University and Purdue. We have been receiving their positive results, but have not yet received all of their negative results. We expect to be adding about 50,000 historical negative results to our test totals over the next week. Because of this, we are putting alerts on our dashboard for Monroe County and Tippecanoe counties, because their positivity rates will be most impacted once these negative results are included. I also want to update you on 3 testing efforts. First, I'm excited to announce that 95 new community testing sites around the state are expected to be operational by October the 1st. These testing efforts are being led by local health departments as a result of grants that we were able to provide through Federal CARES Act funding. The State Department of Health developed this program as a way to get creative and increasing testing options for Hoosiers across our state. And in total, we are awarding more than $30 million to the counties who have applied for the next 2 years. These funds will support supplies, technology, equipment, PPE, and other costs. More than a dozen sites opened last week, and 22 others are scheduled to open by the end of the week. The remainder are set to be up and running by the beginning of the month. These sites supplement the state-sponsored Optum Serve sites, which have tested more than 284,000 people since May. We expect these local health department sites to be able to do between 100 and 200 tests per day, depending on the population density and demand. Some counties opted not to take the funding because they have other testing available. Other counties have partnered together or with a healthcare provider in their community to offer testing. I've been impressed by the willingness to take on this challenge and to help ensure that every Hoosier has access to testing. On another note, we're nearing the end of our second wave of testing for our long-term care staff. As you recall, we tested more than 36,000 staff members earlier this summer. We're wrapping up our work to test approximately 43,000 long-term care staff. Approximately 17,000 other staff were either tested by the facility or tested elsewhere. Once we have completed the analysis from this round of testing, we'll be able to provide updated information on our long-term care dashboard. Long-term care testing is in a period of transition. The State Department of Health will continue to engage with outbreak testing as needed, but the Centers for Medicare and Medicaid Services has provided funding so that facilities can sustain this testing on their own. We are working with the long-term care associations to help determine what this looks like going forward in the future, with a focus on ensuring access to ongoing routine testing. We're also gearing up for Phase 3 of the Fairbanks School of Public Health Prevalence Study, which is expected to start at the end of the month and go into the first week of October. We've learned a lot about COVID during these first 2 phases, especially about asymptomatic individuals. As you recall, about 45% of people who tested positive in the Fairbanks study had no symptoms at the time they tested positive. Our hope is that we'll continue to build on that knowledge in this 3rd phase. We will be testing children this time, ages 5 and above, with an anterior nasal swab. But we will not be doing antibody tests on children, so a blood test under the age of 12. So if you get a postcard from the State Department of Health and Fairbanks addressed to you or your child, know that you were randomly selected to participate. If you receive a postcard like the one on the slide, please don't throw it away. Please participate in the study. Get tested, because your results could help inform strategies to address COVID in our coming months. Thank you.
Thank you, Dr. Box. You want to just go right to Q&A? Let's do it.
Phil with WTHR.
Good afternoon, Phil.
Good afternoon. Couple questions for you here. The State Department of Health received a copy of the CDC Director Redfield's letter on preparing for a COVID-19 vaccine in early November. What guidance was given with that letter? Have you received any other guidance? And what is being established for who will receive the vaccine first and how that might be done?
Dr. Weaver, Dr. Box, you want to go over the
happy.
protocol or the procedure?
So the National Institutes of Science has come out with recommendation for phases of individuals that should get the immunization first or the vaccine first. We understand that there'll probably be somewhere between 10 to 15 million doses to begin with out of 330 million individuals in the U.S. So that amounts to just under 5%. So as we are looking at it, Indiana is using a team of experts that Dr. Weaver is leading to ethically look at and medically look at those individuals that should receive this immunization first here in the state of Indiana. Director Redfield has continued to impress upon us the importance of being engaged regularly with the CDC. And in fact, we have about a 2-hour meeting this Friday to talk about the official rollout of vaccines and how Indiana will be receiving those. And that will be all the states engaged in that. So we have our immunization individuals, my Chief Medical Officer, Dr. Weaver, myself, our individuals that are involved in emergency preparedness, all engaged and ready to work with this. We are already working to make sure that we are going to partner with the different health corporations and institutes in the state of Indiana to make sure that we are able to reach our disparate populations, maybe those individuals that don't normally go to their doctor for health care, to make sure that we can get those immunizations out to those populations also. So there's a lot of work already underway, but we are waiting for more specific guidance and expect that to come here probably at the end of the week. And then from there, we will officially be submitting our plan for vaccination in the next month.
Tom with the Evansville Courier and Press.
Tom, good afternoon.
Yes, I'm here.
Loud and clear.
Okay, thank you. Dr. Box, you mentioned the statewide dashboard that ISDH has been working on. And I wondered, I have two questions. Number one, are the schools required to submit this data to ISDH? And along the way, have you encountered any resistance or reluctance to participate?
Great questions. Number one, I think the biggest resistance that we came up against was that they were having to report to their local health department, they were reporting to the Indiana Department of Health, and now we were asking for an additional reporting for this specific dashboard. So what we've been able to do is to combine that into one portal for reporting, and I'm hoping that that is going to be something that is very pleasing to our schools, making it easier. They've got a lot on their plate right now with having kids back in school and addressing all the things they need to, not only from an education standpoint, but from this pandemic standpoint. Currently, this is not a mandate. This will be a strong request from the Indiana Department of Health. I'm hoping that because the schools themselves and the teachers and superintendents and principals and other external community members are wanting to know this information, that our schools are going to be willing and happy to do this. If not, and we find that individual schools are not reporting, we may have to consider a mandate, but that's not my first plan here.
Kayla Sullivan, Fox 59.
Afternoon, Kayla.
Good afternoon, Governor. Are you considering a penalty for the mask mandate, considering the many photos and videos showing people not complying and the fact that the mask mandate hasn't really changed the numbers much? Health officials predict cases will increase in the colder months and as people head indoors closer together. Is this something that you might consider in the future?
We're not there. I mean, we're right where we were in the very beginning. This is going to take a lot of education on the state's part and local's part. It's going to be enforced, obviously, at the local level. It has been throughout, but we'll continue to remain in the posture that we're in right now, and that is to request folks help us on the ground where this activity is occurring. And we see a lot of progress. You see a lot of signage. I mean, you presented, Kayla, kind of one side of the coin. But I can tell you I've been out and about this last week, and I saw a lot of folks express appreciation for all those who are doing everything they can to make sure we get through this as safely and as swiftly as we possibly can, meaning masking up to stay open. And by the way, and you might want to touch on this more from a numerical perspective, but as you just mentioned, I shudder to think if we hadn't done a mask mandate, where we would be. If we're looking at a 5.3% positivity rate right now, having gone through a couple holidays.
5.1%.
5.1, I'm sorry, yeah, I'm out of date by a day or so. 5.1% positivity rate. So Kayla, it's not what it was 2 weeks ago or 2 months ago. It's actually down. And I think that has to do with, as folks understand, we need to be doing all that we can to slow the spread and to control our way through this. We need to get more people back. On the other side of that coin, you know, businesses, we have all figured out how to be nimble and how to change the way we're doing business and going back to work. You see that in the unemployment numbers going down, and you see the ecosystem in local communities are dependent on folks finding the safe way to get back to work, just as our schools have, by a majority of schools back in session, proving while it's different, while it's not ideal, we're not living in an ideal time. And so we're proving that we can go back to school, whether it's K through 12 or college. We're proving that we can go back to work, evidenced by our unemployment or unemployment numbers. And it's just going to continue to require us to be vigilant, because you see on these maps every week as we update you, it moves around. And so it may be Marion County one day, and it may be Miami County, ding, 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 today. And that's got a lot to do with where these spikes are occurring. But maybe you want to talk about, because Kayla brings up a great point, like,
Right.
Why isn't it zero? If you're wearing masks, why isn't it why isn't it gone? Well,
And I think, Kayla, you make a good point in that there are some people that are not following the mask mandate, but there are a lot of individuals that are. And what I would say about this is that we have no real measurement of where our numbers might be if we hadn't done this mask mandate. And we have seen a decline, not only when we look at our individual unique tests that are positive over the total number of unique individuals tested. I think that's down in around 7.2% this week. And as we look at our total tests over the total positive tests over the total tests that have been administered. So it really is important to look at how much Indiana is opened up and how much we are functioning as a state, not only with universities, but with our K through 12 schools and with our different businesses.
you also want to talk about the study you shared with me about the frontline workers who are masked up and the positivity rate there, how low
Right.
it is.
So CDC had an MMWR report recently that was talking about healthcare workers and the positivity rate among healthcare workers. And the one thing that they found for sure was that individual healthcare workers that said they religiously wore their mask in their healthcare setting had a much lower incidence of having COVID-19 at the time they were tested, or even positive antibodies. So that was just another, I think, key point or fact that we can use to say that these masks do work.
Because those frontline workers are in the most target-rich environment for spread.
Right up close to those individuals
right.
on a regular basis.
And yet they have a very low rate of positivity.
Michael with WBEZ.
Hello, Michael. Good afternoon.
Good afternoon, Governor. Thank you for taking my question. Governor, last week the moratorium for evictions started on Friday as ordered by the CDC. I'm told, however, there are landlords in Northwest Indiana who are seeking to evict tenants with the argument that the eviction notice was done before the moratorium went into effect. Is this something that you're are aware of, and does it sort of comply with the spirit of the moratorium?
No, but Jake Sype can look into this. Obviously, we've put funding in there for folks who are in need, and we're processing all of those applications as we speak, and we'll continue to on good faith. But we're trying to make sure around the table there are mediation routes available, which the Chief Justice articulated just yet a couple weeks ago, and then we'll be there for the folks, the state and cities, municipalities all over the state, trustees as well, who are oftentimes for rent and for utilities assistance. That's the first stop. But the state, and I'm fully aware of cities and towns in the region and throughout the state of Indiana, who are there for that assistance. We're following it at the state on a day in, day out basis and processing through our 36,000. Joe, you want to comment on his specific, are they following the true spirit of the law, by the letter of the law?
Yes. Joe Ahrens, General Counsel. What I can also say is just yesterday, the Indiana Supreme Court did post an FAQ, frequently asked questions about this particular subject on their website. And so it's very comprehensive. They answer the question that you're asking, but they're also laying out how this should work at the trial courts and also for landlords and tenants that are affected by the CDC eviction moratorium. So I would direct you to that as a good resource for information.
Thank you, Joe.
Sherry with the Indianapolis Star.
Afternoon, Sherry.
Good afternoon. I have two questions. I think they're both for Dr. Box. One is I want to hear a little bit more. These are 95 sites in addition to the ones that are currently the 50 Optum sites. Is it free testing? And then my other question would be, what are you going to do? Is there anything that the State Health Department could do to ensure that the tests come back in a relatively timely fashion? I hear on the street that the Optum sites are pretty good about 36 to 72 hours, but it seems like any place else you go, it's a minimum of 5 to 7 days these days. And my second question is, which Governor Holcomb mentioned on the ding, 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 Miami County, 45 new cases.
Got it.
Okay, Sherry, so I'd have to know which labs you're talking about with that 5 to 7 day turnaround time, because I'm not really familiar with that. I will tell you that our lab testing network has a higher turnaround time, a much more quick turnaround time than that. Optum sites have been just a little bit longer than that 48-hour turnaround time, and I think some of that lag is from the holiday weekend. But that is really critical, and we will be dividing these tests up amongst our lab testing network sites to get those tests run. So some of them may be through our Indiana Department of Health lab, or they may be through a regional lab like at Parkview or down in Vanderbilt County, other different sites that are engaged with our lab testing network.
She mentioned cost as well. If you want to talk about the cost of the new sites.
So the average cost, I think, for the local health department testing is at about $80 or so a test. And we've seen as high as $135 to $150 a test. The cost, they will be just like our Optum sites for now. They'll be free testing. Eventually, the goal will be to, run that through insurance companies, because a lot of people are insured. But we will not be turning away anyone that is uninsured or does not have the ability to pay for a test, because it's very critical going forward. And then the Miami County, I believe that we have a Department of Corrections site there, and Dr. Doss is with us, so she might want to comment on that.
Thank you for the question. Kristen Doss, Chief Medical Officer for Indiana Department of Correction. Yes, so we currently are seeing an increase in cases out of Miami Correctional Facility. As of this morning, we have 60 incarcerated individuals who are COVID-19 positive and 10 IDOC staff that are COVID-19 positive. When we started to see an increase in cases going into the Labor Day weekend, I immediately contacted Dr. Bach's team with ISDH, requested a strike team to come out. They came out the next day. We were prepared to test approximately 200 incarcerated individuals and staff. Unfortunately, I did have some incarcerated individuals refuse testing, but we still are going to take care of them nonetheless. At this time, I don't have anybody who's in the hospital. I don't have any incarcerated individuals who are in the hospital. But it is a congregate setting, so we're going to continue to do the things that we know work. So encourage everyone to wear a mask. Our staff, it's part of the dress code and the uniform, hand respiratory hygiene. We are testing everyone before they leave the facility to make sure they're going to have safe, secure housing and not going back out to the community or a homeless shelter. And we will continue to stay at it. We'll push infection control and continue to work with the local officials in Miami County.
Thank you, Dr. Doss.
Meredith with WLFI.
Afternoon, Meredith.
Good afternoon, Governor. I think this question's likely for Dr. Boggs. So how do you think the lack of testing over Labor Day will affect the overall accuracy of the state's positivity rate?
So we see this wax and wane. It's not unusual for us to have times, even just over a general weekend, where people don't get tested or we don't get reports in from different labs. And that's why it's, so important that you look at percent positivity over a period of time, not just an individual day. And that's why we really do that, because we have some labs that will report to us on a Tuesday, or they'll report on a Tuesday, Friday, something like that. So the more that we can, get those negative tests in on a regular basis. The positives, we always get in. They're very good about reporting those very timely, because they know we want to contact trace those. And we are constantly onboarding more labs, just like the Vault lab, so that we make sure that we have access to not only the positives, but the negatives, so that we can get an accurate representation of our positivity.
Lindsay, Indianapolis Business Journal.
Afternoon, Lindsay.
Good afternoon, Governor. I was wondering if you could explain why your administration is not participating in the payroll tax deferral program, and also if you could give an update on when Hoosiers can start to see that $300 in federal unemployment benefits. Some states have already started paying it out or are going to this week or next, so where's Indiana at?
Right. Fred is rushing the microphone right now. I'll just very quickly, Fred, take your first question. We just decided, Lindsay, to not pursue this as a state. Obviously, it's a delay, and you'd end up having to pick up in January and pay double. So understanding that, we just made the decision to forego it. And Fred, you want to take the second?
Sure. So the team is still working on putting together the infrastructure for the LWA payments. As we said initially, it would take us about 2 to 4 weeks for payments to start, and we're still on track for that. Right now, we're estimating that payments will start going out on September 21st.
Perfect. Thank you.
Rob Burgess, the Wabash Plain Dealer.
Rob, good afternoon.
Good afternoon, Governor. These are two questions for Dr. Box here. In the past, when I've seen the local 7-day positivity rate for unique individuals and individual tests, their percentages in these two figures, at least for Wabash County, have been remarkably similar. For the last week or so, our figure for unique individuals has shot up to almost double that of all tests. What kind of local change? What does that kind of local change mean to you from a data perspective?
So what that means is that more of those negative, probably antigen tests, are getting onboarded. We made a point of adding tests from July 31st on, but we know more of the historical negatives are being onboarded, and more labs are coming on board. So if there's starting to be a wider gap between those two, it's probably the negatives that are being reported from these tests.
Okay, and then my second question was, I wanted to see if I could get your take on a New England Journal of Medicine article published last week that said that masks might crudely immunize people through the process of, I'm going to say this wrong, but variolation, which basically states that if a lower viral load reaches the nose and mouth, it might prompt the body to produce immune cells that can remember the virus and fight it the next time.
I don't know that I have a comment on that specifically. I mean, I know that the nose is the most likely area for an individual to get infected, and that's why when I see people wearing their mask like this, it concerns me a lot. It really does need to be up over your nose. I mean, if you think about an immunization, it's a small dose of a particular killed virus or live virus, and the concept there is that our body will react to it and will actually develop antibodies or long-lasting, we hope, immunity to that. But I don't know that I can comment more specifically on that.
Dan Klein, Wish TV.
Afternoon, Dan.
Afternoon, Governor. I have two questions for you. First, Indiana University has reported more than 1,200 cases since August 22nd. Is it still safe to send students there back to the classroom?
Yes, with the protocol that they have.
Fair enough. All right, thank you. The other question I have is, probably you're aware, I hope that news out today that has come out that said that President Trump has acknowledged the coronavirus was deadly in interviews with Bob Woodward for his new book, even as later on he somewhat dismissed the danger at times. Governor, do you believe the president has downplayed the virus, and has it made it harder to get people to wear masks as a result of this?
Not with me, and I'll say today what I said, I think the very first time we gathered in the atrium when someone asked me how I would characterize this virus. That was months ago, and I pointed to my right and my left, I think, to a couple doctors, and I'll continue to, here in the state of Indiana, rely on physicians and scientists and epidemiologists to give me all the right counsel before we make any decision. But we'll never downplay it here.
Whitney, CNHI.
Afternoon, Whitney.
Good afternoon, Governor. I have a question about antigen testing and those devices that were sent to the nursing homes from CMS. And then I have a second question. Sure. So my first question is, do we have any concerns about the high double-digit false negative rates that some of these devices are seeing, especially when it comes to controlling the spread of COVID in nursing homes?
Yep.
So Dr. Weaver's coming to the podium to discuss that.
Hi. So we have been in communication with all the long-term care facilities and have supplied them actually, with the graph that the CDC has posted on their website, exactly what to do when you have a result. So if you're screening people, so that means they're asymptomatic, have no symptoms, and you're just doing the test to see maybe if they're an asymptomatic positive, and that test comes back positive from the antigen machines, because we know that there is a small risk for a false positive there, we actually have them follow up with the PCR test, which we believe would be more accurate at that point. And then additionally, if you have someone who's symptomatic and they test positive, then since you have a high likelihood that that person actually has COVID, then you can stop at that point. So there is recommendations and guidance around that. We continue to inform the long-term care facilities as well as our providers how to best use those machines.
Whitney, did you have a second question?
Well, yeah, actually, I was just double checking my notes. I was asking specifically about false negatives, and Dr. Weaver kind of talked about false positives. I was kind of more concerned about how those false negatives might impact the nursing home care.
Got it.
Okay, so yes, false negatives too. So we do know that they are slightly less sensitive than the normal PCR tests that we do. So we say that those PCR tests are typically around 70% sensitive, and the antigens may be closer down to 60%. So same thing, we use the same diagram to help talk people through that. So low likelihood that someone is positive, meaning they have no symptoms, they haven't been a close contact. If you get that negative test back, you can say, okay, that test was negative and it fits the picture that we're looking at. But if you have someone that's symptomatic, or maybe someone that is a close contact, and you get a negative result on your antigen test, then again, we ask that they follow up with the PCR test.
Don't go anywhere.
Okay.
And then, just one more question. I wanted to ask about an essential caregiver program, similar to what the state of Florida has done. A lot of family members, still haven't been able to get access to certain nursing homes that may be in areas where community spread is higher, and Florida has implemented a essential caregiver plan. I was wondering if Indiana was considering anything similar.
Hi, Dan Rosiniak, Chief Medical Officer for FSSA. Yes, in fact, we did. So we implemented the essential caregiver plan back in the middle of June, and I think we were one, if not the first state to do so. So we put out those guidelines. They're available on our website for how long-term care facilities can once again reestablish that essential caregiver in their facilities and the guidelines around doing it.
Brock Turner, WFIU.
Good afternoon.
Good afternoon, Governor, Dr. Box. I know there is a mask mandate, but what, if any, enforcement do you plan on implementing for polling sites? Do you expect poll workers to enforce this mandate at their polling sites? I know a number of police departments locally have come out and said that they're not going to enforce any sort of mask mandate. So I'm just curious of how, indoor polling sites, how you plan to manage that, or if you plan to enforce that.
Yeah, probably better for the Secretary of State, Connie Lawson's office. However, she has equipped, and all of our polling sites will be equipped with all the necessary PPE that they need to pull off safe elections and secure elections, just like we did in the primary. And I would expect it to go as smoothly as it did back in June. I was about to say May, but we had to delay it. And I voted in person. I know obviously a lot of people are voting via mail, but I think equally so, there'll be a large turnout in person as well. A lot of people still prefer that. So I think Hoosiers should take comfort, and there'll be a procedure. There'll be a lot of signage up, and there'll be a lot of PPE, an ample amount to make sure that we can pull off safe elections.
Tom Davies, The Associated Press.
Hi, Tom. Good afternoon.
Hello, Governor. Are the county ratings giving people a false sense of security about the risk of infections with fewer than 10 counties and the first two maps being listed as in the orange or red categories?
I think
I didn't hear his first sentence. You said are
the county metrics that we're showing on the maps.
Gotcha. Yeah.
So I would say that the two metrics that we use to produce the color, we also produce the maps that show specifically the percent positivity and show specifically the number of cases per 100,000 people in that community. And I think the important thing there is that we are showing when individual counties may be headed a direction where they don't want to be. So I would hope that it doesn't do that, but what we do try to do then is to also look at the map and to say, hey, we know this county, Miami County, has a particularly higher number of cases coming from the Department of Corrections, or we know that this county may have a higher number of cases that are coming from the university, like Ball State, or we know that this county has a higher number coming from a long-term care facility. So you can look at these metrics yourself. The local health departments and local health personnel can work with counties to be stricter with regards to what they consider to be a place where they want to lock schools down or lock down universities or businesses. But we are very clear and transparent in what metrics we use for these maps.
Yeah, I was going to say, Tom, these serve as a radar, and it's not the only information you want to consume, but it is a good combination of a lot of different factors that flow into one easy-to-read map to help guide. Yes.
Nikki Kelly, Fort Wayne Journal-Gazette.
Afternoon, Nikki.
Hi, I was wondering if Dr. Box and you, Governor Holcomb, can tell me, A, if you have any concerns about the safety of an upcoming vaccine, given the compressed time frame, and B, will you both personally be receiving the vaccine?
I knew you were going there, Nikki. I will seek not a second opinion from a doctor, but I will seek Dr. Box's opinion before I take any vaccine. But I will seek a professional's opinion before I do. And you want to comment on?
So with regards to whether we take this vaccine, I don't think that we will qualify in the original categories, probably based on what I'm seeing from federal government regulations and recommendations with regards to this. So again, I want to make sure that I take it at the time that it's appropriate for me to take it, or the governor. The other thing that I want to say is I know there's a lot of talk out there about the vaccine already, and unfortunately a lot of coming down both sides of the aisle as to whether this is going to come out and be rushed out and not be safe. I want you to know that the pharmaceutical companies that are engaged in producing these vaccines are committed to not rolling out a vaccine until they have fully vetted that vaccine. And that the FDA is also committed to making sure that we stick very closely, as are these pharmaceutical companies, to the highest standards for ethics and the highest standards for scientific principles in developing these vaccines, so that we will be looking at all of that, and that the state of Indiana, with the committee that we have brought together, will actually be looking at all the data surrounding these vaccines to make sure that we also can vet those vaccines and agree that these are safe to be offering Hoosiers across our state.
But probably, Nikki, I mean, you raise a good point. I'm going a little off track here, but when the time rolls around that we get our flu shots, we probably should get our flu shots. I know I will be.
100%.
Which, a little different topic, but plays into the same
important
conversation.
The masks may, and washing our hands may help to decrease influenza and make this a better season, but the influenza immunization is critical to making sure that we don't increase the burden as we normally do during this time of year through about March and April on our hospital systems with influenza. So please get your influenza vaccine, and we're going to be making sure that we offer it in many more places to make it as easy as possible for Hoosiers to get those vaccines.
So a flu shot and an apple keeps the doctor away.
Yeah.
Right, good.
Brandon Smith, Indiana Public
Brandon,
Broadcasting.
good afternoon.
Afternoon, Governor. My internet's a little spotty today, so forgive me if you don't get all of my questions. I have two. First is for Commissioner Payne. On the FEMA benefit, for lack of a better term, it seems like Department of Labor guidance tells states that if the FEMA unemployment fund the fund runs out, people won't get the extra $300 in benefits, even if they would have been eligible, but still had maybe outstanding issues with their claim that are later resolved. If that's correct, what do you say to people who will miss out on those benefits because the state simply hasn't been able to resolve their eligibility issues in time? And then I'll have a follow-up for you, Governor.
Sure, that's a very good question, and we've been working with FEMA and the Department of Labor to try to address this issue. We're making sure that we try to get as many claimants paid and updated as possible, and we're going to try to address that issue as it arises. I can't give you a definite answer on that right now, other than our goal is to ensure that every Hoosier who's eligible will receive the $300 benefit.
And then, Governor, how is the state enforcing complaints about businesses that aren't complying with the still existing regulations under stage 4.5 that we've been under for a couple months now?
Well, our agencies, various, will continue to do their jobs, and when they are in receipt of complaints, they'll pay a visit. These are supposed to be instructional and educational, and will continue to remain, as I said earlier, in that posture. This is about making sure people are equipped with the right information, knowing what works, knowing that masking up means that we stay open and open up more and more and more. And so we want to keep that trajectory going down, proving that what we're doing right now, we're managing our way through this. Indiana is proving we can do this. And of course, there has been catastrophic loss. There has been heartache and heartburn in proportions that we've just not seen in our generation or lifetimes. But as we sit here today, more and more folks are coming online. And so that's the direct appeal is do it, yes, for yourself, but also do it for your neighbor. And that's what we're, that's what and why we are working with our local counterparts, our partners on the ground that are in our places of business, that are in our schools, that are in our various agencies throughout the state of Indiana. It's going to take us all, like we always say, it's not just rhetorical. We're all in this together, like it or not, and we're all going to get through it together. And I suspect we'll be even stronger on the other side once we get to that day of vaccine and once we get on the other side. But it'll take a lot of instruction and enforcement at the local level.
Adam Wren, Indianapolis Monthly.
Good afternoon, Adam.
Good afternoon, Governor. In a September 8th letter to Indianapolis Metropolitan Police Chief Randall Taylor, your state police superintendent, Doug Carter, questioned the mayor's use, or the mayor's and the department's banning of chokeholds. And this came just a few weeks after your challenge for them to review chokeholds in general. So can you explain that discrepancy?
Sure. Well, I wouldn't describe it as a discrepancy. One, we're moving forward with exactly what I said, and two, I see the superintendent making his way to the podium. But Ilea, I don't want to put words in your mouth, but Ilea's got a job to do, and you're going to continue to do it, and it's going to require collaboration. But you want to just elaborate on Adam's specific question about the letter that you forwarded?
Yes, sir, I will, Governor. Thank you, Adam, for the question. Excuse me. We live in extraordinary times, and the letter speaks for itself. We, and specifically I, am tasked as the chair of the Law Enforcement Training Board by the very nature of the position that I hold to represent some 18,000 law enforcement officers in the state of Indiana. Part of the charge of that board is to review and approve curriculum, both for in-service training and for the academy settings. So that's what we'll do. For the next 2 weeks, we'll collaborate and we'll do the very, very best we can to sit down with those, the leadership within the IMPD, and I'm confident we can come up with a reasonable resolution. But our job is to very objectively, not subjectively, but very objectively review all curriculum with first and foremost that frontline law enforcement officer in Indiana. The vast majority of them are good people.
Oh, yeah. A vast majority, like 99.99% are heroic. Thank you.
Steve with KPC Media.
Good afternoon, Steve.
Good afternoon to you. How are you doing today?
Doing good. Yourself?
Good. I wanted to ask, this past weekend, Indiana crossed the 100,000 cases all-time threshold, nearly 6 months to the day from recording its first case. So I was just hoping to get your reaction to crossing that milestone. And then in relation to that, back in the first round of the Fairbanks testing, we heard that at that time we were only finding about 1 out of every 10 or 11 cases via testing. I know that testing has gone way up. I was wondering if we had any updates or any ideas. Do we feel that we're catching many more of the cases that are out there, or are there still a lot that are kind of transmitting throughout the community at an invisible rate?
Well, I can turn it over to you, but I would say, I don't want this to sound callous, Steve, but I think that number was inevitable without a vaccine out there. We knew this day was coming, and we know there'll be more tomorrow. Our job is to be as prepared as we humanly can be and to continue to religiously practice good hygiene and test and trace and do everything that we can to slow, know, and follow COVID-19 where it is infecting our population. And so it is, yes, sad. It's just as sad today as it was on that first day when we had our first loss of life in press conference. I'm still not over that one. But every time we add 17, these are people's family members. And that's what it all comes back to is, the loss of life for sure, and then the livelihoods that are lost because of bad practice. And so, I never look forward to these updates. But I can tell you on the other side of this, I'm very, very, very proud of everyone that is pitching in and going the extra distance and converting their, factory floor lines to PPE production, and church groups that are getting together and making masks for their community and assisting the frontline workers that are caring for all those who are in need. And so it's a long-winded answer to your short question, but we have to continue to be prepared and execute the plan that we have in place, and it requires everyone on the team playing by the same rules. That's the way we get through it and get to victory.
I think those are all excellent points, and I would say that we undoubtedly are probably picking up on more of those cases because we are testing a lot of asymptomatic individuals. We can look at the questions that we ask of individuals when they register to be tested at our Optum sites or at our drive-thrus or our strike teams, and know that we are testing some asymptomatic people that may be pre-symptomatic. They may get symptomatic in the next 48 to 72 hours. But realistically, there's also an equal number of people out there that have such mild symptoms or really no symptoms that we will find more positivity. And that's when they looked at the study of healthcare providers. Many of them did not have any concept that they had actually come in contact and been infected with the virus. So again, if they were wearing their masks, their risks were much lower to have come in contact and gotten infected with it. So we don't have anything more today than we did when we started this in April and March, and that is hand washing, social distancing, and wearing our masks. Staying home if you're sick, and answer the call if we call you, please, about contact tracing, because we really can help prevent the spread.
Our final question is from Eric Berman, WIBC.
Eric, good afternoon.
Good afternoon, Governor. Good afternoon, Dr. Box. I wanted to go back to the question about a prospective vaccine. Did I understand you correctly that Indiana you could envision a situation where Indiana does not view a vaccine as safe even if it is approved by the FDA?
I think that that is highly unlikely, but I want you to know that we have a team of research experts and physicians, infectious disease experts, ethicists that will be looking at all of this, and they're helping us to plan the distribution of the vaccine, who should get the vaccine first. They'll be reviewing all the data that comes out with regards to each one of these vaccines, not only to make sure that we feel that that is safe, but also to make sure that we administer the vaccine according to the vaccine's recommendations. So I think it's highly unlikely because I feel like the pharmaceutical companies and the FDA have at their heart the absolute desire to ethically present to us and scientifically the best vaccines that they possibly can.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.